Good morning, everyone. I'm really honored and privileged to be here, and I want to thank Will for inviting me and for organizing such an awesome meeting. Um, I was asked this morning to represent Her Excellency Betty Akeredolu. She had a flight delay, so she's still on her way. And so it wasn't prepared for, but I worked very closely with her, and we discussed what she was going to present today, and I think I'll be communicating most of her thoughts to all of you. A lot of you is probably familiar with her, but she's a 21-year cancer survivor. She's the First Lady of Ondo State, located in southwestern Nigeria, and she's the founder of Breast Cancer Association of Nigeria. And I just want to go quickly and highlight some of the cancer initiatives that have been carried out in Nigeria in the past recent years, and then kind of focus on Ondo State. So the outgoing Minister of Health in Nigeria, Professor Isaac Adewale, is an oncologist, and one of the things he kind of set in the Buhari administration's first term was to improve cancer care in Nigeria. And it started by the launch of the National Cancer Control Plan that is supposed to be from 2018 to 2022. And in the National Cancer Control Plan, there were several initiatives, like 7 goals that were addressed in that plan. One of it was access to cancer medications and cancer care for most of Nigeria's population. There are 2 major organizations that are working with the minister regarding that. One of them is CHAI and the American Society for American Cancer Society, and also BioVentures for Global Health, which are working to improve access to innovative cancer medicines in Nigeria. There are also initiatives on improving radiotherapy care in Nigeria. There's been a cancer center launched in Lagos. It's called the Lagos University Teaching Hospital National Sovereign Investment Authority Cancer Center. It's an investment of $10 million by the Nigerian Sovereign Fund in Lagos University Teaching Hospital. There's also been new installations of radiotherapy machines in National Hospital Abuja. And there are just several activities happening in Nigeria to improve cancer care. As you all know, Nigeria is the largest country in Africa in terms of population and in terms of GDP. It's about 200 million people. And I think Nigeria has an opportunity to be a leader in global oncology and kind of bridging the divide between wealthy countries and low and middle income countries. In Ondo State, it's kind of a unique state whereby the wife of the governor, who I'm representing here, is a breast cancer survivor, and she has been in the cancer advocacy space for over 2 decades. After experiencing the gaps in healthcare in Nigeria when she was getting her cancer treatment. Thankfully, she's alive today, and she's kind of one of the shining torches of cancer control in Nigeria. And the government in Ondo State started an initiative to build a cancer center, or rather a radiotherapy center within one of the medical centers in Nigeria, in Ondo State. It's called the Federal Medical Center. Right now, we've gone through great lengths to bring a lot of the stakeholders together. There have been a land identified now, and Varian is being engaged to start the construction of bunkers for a radiotherapy center in Ondo State. And as you know, that in the whole of Nigeria, there are only about 8 to 9 radiotherapy centers. The World Health Organization recommends that there should be 1 radiotherapy machine to 1 million people. And so and Nigeria is 200 million, so ideally there should be like 200 million radiotherapy units in Nigeria, but right now there are just like 9. And I'm sure some of you might have read the op-ed in the Washington Post, I think it was last year, where they said dogs had better access to radiotherapy in the US than in Nigeria. So that definitely sparked a lot of political debates, and I think some of those op-eds are good to kind of wake waking up leaders to act and to make sure that such op-eds won't have the light of the day when there are more people that have access to treatments. The other thing that I think needs to be addressed and that oftentimes is skipped is human resource. A lot of times we think about we think about equipment, we think about doing all these things, but we pay less attention to the people that are going to handle those equipment or do the treating. So one of the things Ondo State did very recently was to sign an MOU with Harvard to collaborate on training. And right now there have been a number of health workers that have been identified, radiation oncologists and medical physicists, that are going to be starting short-term fellowships. These are fellowships that are 3 to 6 months. And these are not training, this is not the sort of training that is like a whole training curriculum. It's, a lot of these people have already been trained for many years. They just need to update their skills, be very conversant with the latest equipment that are going to be installed. And there are several sites in Africa that Harvard already has, and including Boston. And so we believe that we plan that by Q3 of this year, some of those professionals will be going there to be trained, and then construction of the radiotherapy unit will start sometime in Q3 of this year. So those are some of the initiatives that are taking place in Nigeria at the moment. And I think the panel here, there are no better people suited than the excellent panel we have here to sort of discuss ways these sort of initiatives can be accelerated. As the president of the NAFABA said, that cancer does not wait. No matter how many meetings we'll have, anyone that is diagnosed of cancer will still have the cancer cells growing. So we need to act fast, and the only way we can make meaningful progress is through collaboration, through these sort of meetings and taking action. Thank you very much.